Hello all. So today we are talking about the health-related components of fitness. This is chapter 7 and part 3. So health fitness can help prevent hypokinetic diseases, which are caused by insufficient physical activity. The components of health fitness include cardiorespiratory endurance, body composition, muscular strength and endurance, and flexibility. In this section, each fitness component is defined, its relationship to health delineated, methods to improve the fitness component discussed, and techniques to measure the component identified. So cardiorespiratory endurance is the body's ability to deliver oxygen effectively to the working muscles so that an individual can perform physical activity. Efficient functioning of the cardiovascular system, the heart and blood vessels, and the respiratory system, the lungs, is essential for the distribution of oxygen and nutrients and removal of waste from the body. The performance of sustained, vigorous physical activities is influenced by the efficiency of the cardiorespiratory system. The more efficient the system, the greater the amount of physical activity an individual can perform before fatigue and exhaustion occur. Performance diminishes greatly when sufficient oxygen cannot be provided by the cardiorespiratory system to the working muscles. Cardiorespiratory endurance is regarded as the most important component of health fitness. Because of the benefits derived from improved cardiorespiratory function, such as the potential for reducing the risk of cardiovascular disease, improving work capacity, and providing greater resistance to fatigue, this component, if properly developed, can make a major contribution to an individual's health. Cardiorespiratory endurance is concerned with the aerobic efficiency of the body. Aerobic efficiency is the body's ability to supply fuel and oxygen to the muscles. One of the major factors influencing aerobic efficiency is the capacity of the heart to pump blood. A well-conditioned heart is able to exert greater force with each heartbeat. Consequently, a larger volume of blood is pumped through the arteries and throughout the body. Cardiorespiratory fitness can be improved and maintained through a well-planned program of exercise that follows the FITT formula. Physical activity of an appropriate frequency, intensity, duration, and type can enhance cardiorespiratory fitness. ACSM recommends that we exercise 3 to 5 sessions per week for a minimal improvement in cardiorespiratory fitness. Many individuals choose to work out more often. However, the body must have time to recover from the effects of exercise. Exercising every other day and following a strenuous workout day with a less strenuous recovery day are strategies individuals can implement to allow the body to recover. Intensity suggests that for development of cardiorespiratory fitness, physical activities must be of sufficient intensity. During exercise, heart rate changes in proportion to the energy requirements of the task. As the energy requirements increase, there is a corresponding increase in heart rate. Thus, heart rate can be used to monitor the intensity of exercise. Because heart rate slows within 1 minute following exercise, it is often recommended that the pulse be monitored for 10 seconds and then multiplied by 6, or monitored for 6 seconds and multiplied by 10 to determine beats per minute. For an accurate reading, the heart rate should be monitored within 15 seconds of the cessation of exercise. Of course, wearing wearable technology can help you with that as well. Exercising at the appropriate intensity is essential for a safe and effective workout. Intensity can be controlled by speeding or slowing the pace of exercise. To realize training benefits, the intensity of the exercise must be regulated so that the heart rate is elevated to a predetermined level and maintained within a certain range. This level is called the threshold of training, and the range is called the target heart rate zone. And you can see here the requirements or the recommendations by American College of Sports Medicine that we exercise 3 to 5 days per week. Our intensity should be about 55 to 90% of our maximal heart rate, and our heart rate max at 40% to 85% of our heart rate reserve. And time about 20 to 60 minutes, and some type of aerobic activity. We'll go into more detail here in a moment. So the ACSM recommends that individuals who desire to develop and maintain cardiorespiratory fitness should exercise at one of the following intensity levels: 55 to 65% on the low end, and up to 90% of your maximal heart rate. If you're looking at the heart rate reserve, and we'll talk about it, you're looking at 40 to 50% on the low end, up to 85%. And then maximum oxygen uptake reserve, the lower intensities should be 55 to 64%, and 40 to 49% of heart rate reserved are most appropriate for those who have a low level of fitness. Maximal heart rate for both males and females is estimated to be 220 beats per minute. Maximal heart rate is related to age. As individuals age, their maximal heart rate decreases. So to calculate the heart rate max, you're going to use 220 minus your age, and then it would be, like we said, 55 to 65% on the low end, up to 90%. So you'd multiply, so it's 220 minus your age, and then multiply those by 55 to 90% to get your target heart rate. For your heart rate reserve, you actually calculate in your resting heart rate. So you calculate the heart rate max and then subtract your resting heart rate, and eventually you do add that back in. So these are the two formulas that you can utilize: the target heart rate zone, or heart rate max, and the heart rate reserve. Body composition is a description of the body in terms of muscle, bone, fat, and other elements. With respect to health fitness, it refers to the percentage of body weight composed of fat as compared with fat-free or lean tissue. Having a high percentage of body fat is a serious deterrent to fitness and health. Overweight and obesity are associated with increased risk for coronary heart disease, type 2 diabetes, and certain types of cancer, as well as low back pain, respiratory problems, and musculoskeletal disorders such as knee osteoarthritis. Additionally, overweight and obese individuals may experience social stigmatization, discrimination, and poor body image. Body composition is influenced by nutrition and physical activity. Although body composition is genetically related to body type, the nature and amount of food consumed and the extent of participation in physical activity exert a profound influence on body composition. Poor nutritional practices contribute to an unfavorable body composition. Eating more calories than needed and consuming a high-fat diet lead to high percentages of body fat. Sedentary individuals have lower levels of caloric expenditure. Leading a physically active lifestyle can contribute to a favorable body composition. Energy balance is important to achieving a favorable body composition. The relationship between food intake and energy expenditure is critical. This relationship is often referred to as energy or caloric balance. Energy or caloric balance is equal to the number of calories taken into the body as food, and then minus the number of calories expended. And you can see other things that affect energy is expended through three processes. One is basal metabolism, or maintenance of essential life functions, breathing, sleeping, those types of things. Work, which is any activity requiring more energy than sleeping and includes exercise. And excretion of bodily wastes. Height and weight tables traditionally have been used to determine desirable body weight. However, over recent years, body mass index, or BMI, has been the primary assessment to identify whether a person is underweight, normal, overweight, or obese. Although BMI has been statistically proven to be valid and reliable and is endorsed by the CDC, certain athletes, such as football players, could be classified as overweight according to the BMI calculations. However, when their body composition is examined, the excess weight is attributable to muscular development, and their overall percentage of body weight is quite low. A professional football player can weigh 250 pounds or more, yet have only 12% body fat or less. The important consideration with respect to health fitness, therefore, is not weight, but proportion of fat to lean tissue. The average percentage of body fat is 18% for men and 23% for women. The percentage of body fat should not be less than 3% in men and 12% in women. The higher percentage for women is necessary for protection of the reproductive organs. Extremely low percentages of body fat are hazardous to one's health. It is highly important that professionals and the public realize that a certain amount of adipose tissue or fat is essential for the body to function. Body fat also serves to protect internal organs. The goal of fitness programs is not eliminating body fat, but helping individuals attain desirable levels of body fat. So you can see here your BMI is your weight in pounds multiplied by 703 and divided by your height in inches squared. And you can see the classifications. Energy balance is important to achieving a favorable body composition. The relationship between food intake and energy expenditure is critical. The relationship is often referred to as energy or caloric balance. Energy is expended through three processes, which we talked about a moment ago. A neutral balance occurs when the caloric intake is equal to the caloric expenditure. Under these circumstances, body weight is maintained. When a positive balance exists, that is, when more calories are consumed than expended, the excess is stored as fat and body weight increases. A negative balance occurs when more calories are expended than consumed. This results in weight loss. Weight control requires maintaining the appropriate energy or caloric balance. Body composition can be improved. Individuals who have an unhealthy percentage of body fat can reduce it by modifying their lifestyle. Fat loss can be accomplished by several means: consuming fewer calories through dieting, increasing caloric expenditure by increasing the amount of exercise, and combining a moderate decrease in caloric consumption with a moderate increase in exercise or caloric expenditure. Exercise increasingly is being recognized as a critical component of fat loss. Often, those desiring to lose fat focus on counting the number of calories consumed and neglect the exercise component. Exercise can aid in fat loss in several ways. It can increase caloric expenditure, it can suppress appetite and thereby contribute to reduction in caloric intake, and it can increase the metabolic rate for some time after vigorous exercise, thereby permitting extra calories to be burned. It can also contribute to health fitness. Also, because sedentary living contributes to poor body composition, incorporation of regular appropriate exercise into one's lifestyle helps to successfully manage one's body composition. Note that individuals who desire to gain weight should focus on increasing lean body mass or muscle rather than body fat. This can be accomplished by following a sound muscle training program in conjunction with an appropriate increase in caloric intake to realize a gain of 1 to 2 pounds per week. Failure to incorporate muscle training as part of a total fitness program will result in excess calories being converted to fat. Thus, even though the weight gain is achieved, the percentage of body fat may be less than optimal. Therefore, a weight gaining program should combine a reasonable increase in caloric intake and a well-planned muscle training program to achieve an optimal body composition. Body composition can be measured. There are several methods that can be used to determine the percentage of body fat. One of the most accurate methods is hydrostatic weighing. This involves weighing an individual on land and then in an underwater tank. Body density is then determined, and this information is used to calculate the percentage of lean body weight and body fat. This technique is used most often in exercise physiology labs and hospitals. It requires expensive equipment and is time consuming, and it's just not practical for use with large groups of people. Air displacement plethysmography, also known as the BOD-POD, offers another means of assessment of body composition. Similar to hydrostatic weighing, the BOD-POD uses air instead of water. A person sits in the enclosed chamber or pod, and computerized sensors measure the amount of air displaced by the person's body. This approach offers similar accuracy to underwater weighing without requiring a person to be submerged in water. It's easy to use, but its cost limits its availability. This technique is used most often in exercise physiology labs or clinical settings. Dual energy X-ray absorptiometry, or DXA, or DEXA, is an extremely accurate way to assess body composition. This technique requires that the individual lie on a table while a machine using two energy sources scans alongside the body. This procedure yields an estimate of the body's density as well as information about the amounts of fat stored in different parts of the body. DEXA is now considered the gold standard for measurement of body composition. Because it is extremely accurate, DEXA estimates of body composition can serve as a criterion by which other techniques such as skin folds can be compared. Assessment of body composition with this technique is typically performed in exercise physiology research labs or in clinical settings. Bioelectrical impedance analysis is an increasingly popular way to assess body compositions. Electrodes are attached to an individual's body at the wrist and ankle, and a low-level electrical current is sent through the body. The resistance to the flow of the current as it passes through the body is measured. Because muscle tissue has a greater water content than fat tissue, it conducts electricity better and offers less resistance to the current. The resistance to the current is greater when there is a higher percentage of body fat. The resistance to the current and body size are used to estimate the percentage of body fat. There are also scales that incorporate the same principles to provide estimates of body fatness. The individual stands on a metal plate atop the scale and the resistance to the flow of the current is measured. Bioelectrical impedance analysis can be performed relatively quickly, making it easy to use in field-based settings or to screen large groups of people. Of the alternative approaches to measurement, the most common is the use of skin fold measurements. Skin fold measurements are taken from several selected sites such as the triceps, subscapular, and thigh with skin fold calipers. Formulas are then used to calculate the percentage of body fat. This method is relatively inexpensive and can be used with large groups of people and produces accurate information when performed by well-trained individuals. Ectomorphs tend to be long-limbed and not particularly muscular. You can be skinny fat, meaning you are relatively low weight and or small size, yet still have high body fat. There are 3 different types of body types, and so we're talking about the ectomorphs. Ectomorphs are the body type that is the most resistant to weight gain because of a fast metabolism. In other words, ectomorphs are often able to overeat while gaining little or even no weight. People with this body type have little observable fat, are only lightly muscled, and have a small frame and joints. Basically, your genetic makeup limits your ability to put on muscle mass. When training, focus on power and resistance training to build strength. Mesomorphs, on the other hand, find it super easy to build muscle mass, and you are generally proportionally built. Mesomorphs can lose and gain weight easily, are able to build muscle quickly, and usually boast an upright posture. This body type tends to have a long torso and short limbs. Women with a mesomorph body type are strong and athletic. Mesomorphs excel in explosive sports, that is, sports calling for power and speed. The reason for this talent lies in the types of muscle mesomorphs possess. Mesomorphs have a higher percentage of fast-twitch muscle fibers and will gain muscle mass more quickly than any other body type. Basically, your genetic makeup suits power and strength. For training, focus on moderate endurance training or high-intensity interval training or HIIT and plyometrics. You can add in Pilates or yoga to lengthen with strength. And endomorphs are generally softer and rounder and tend to store fat easily. Endomorphs are the body type that are most likely to feel like they drew the short straw. Endomorphs naturally tend to have curvy, fuller figures and struggle to keep their body weight percentage in check. The most difficult challenge for endomorphs is perhaps to find out that they are in fact an endomorph. Why? Once you know you are an endomorph, it can be difficult to come to terms with the realization that you are likely to gain weight very easily. Muscular strength is the ability of muscle or muscle group to exert force against a resistance. Specifically, it is the maximum amount of force that a muscle or muscle group can apply against a resistance in a single effort. The ability of a muscle or muscle group to exert force repeatedly is known as muscular endurance. Muscular endurance also refers to the capacity of a muscle or muscle group to sustain a contractive state over a period of time. Different muscles in the body can have different levels of strength and endurance. Moreover, muscles used more frequently are stronger and have greater endurance than muscles used less frequently. When muscles are not used, strength and endurance decrease. Muscular strength and endurance are important to good health. They contribute to the maintenance of proper posture and the improvement of personal appearance. Because strong muscles provide better protection for body joints, the risk of joint injuries is decreased. Millions of Americans suffer from low back pain. Weak abdominal muscles and poor flexibility contribute to this problem. Strengthening the appropriate muscles and developing increased flexibility can help alleviate this condition. High levels of muscular strength and endurance are important for athletes. Strength is a critical component of sport performance. Strength training for sport must be specifically related to the particular characteristics required for performance of the sport. Thus, the strength training of a sprinter will differ markedly from that of a shot putter, which will be different from that of a gymnast. For effective performance, each athlete requires the development of a high level of strength in specific muscles or muscle groups. There are different types of muscular exercises. Isometric, isotonic, and isokinetic exercise can be used to develop muscular strength and endurance. Body movements depend on the contraction of muscles. As a muscle contracts, tension is created within the muscle, and the muscle shortens, lengthens, or it remains the same. Isometric exercises a muscle contracts isometrically when it exerts force against an immovable resistance. Although tension develops within the muscle, the length of the muscle remains relatively constant, and there is little to no movement on the joint. Therefore, it's referred to as a static contraction. For example, stand in a doorway and place the palms of your hands at shoulder height against the frame. Push with all your might and feel the tension develop in your muscles. Even as you grunt and groan, you contract your muscles to their maximum. It is impossible for you to move the resistance, in this case, the door frame. Isotonic exercises, on the other hand, the contractions occur when force is generated while the muscle is changing in length. For example, to lift a weight from its starting point when performing a bicep curl, the bicep muscle must contract and shorten in length. This is called a concentric contraction. To control the weight as it is lowered back to the starting position, the biceps muscle continues to contract while gradually lengthening. This is referred to as an eccentric contraction. When exercising isotonically, it is essential to use both concentric and eccentric contractions for the greatest improvement to occur, and also to exercise through the range of motion. Isokinetic exercises, on the other hand, lengthen the muscle. The length of the muscle changes while the contraction is performed at a constant velocity. Isokinetic devices such as the Cybex are designed so that resistance can be moved only at a certain speed, regardless of the amount of force applied. The speed at which the resistance can be moved is the key to the exercise. Because isokinetic machines can be expensive, they are most often used in the diagnosis and treatment of various injuries. Muscular strength and endurance can be improved. There are many different methods of training that can be effective to develop these fitness components, although weight training is not necessary to realize gains in muscular strength and endurance. This approach is popular with many people. The term progressive resistance exercise is commonly used to denote weight training programs that involve working out against a resistance that is progressively increased as the muscle adapts to the workload or resistance. When planning a training program, one might consider the weight used per lift, the number of repetitions per set, the number of sets per workout, and the number of workouts per week. Because there are so many weight training programs available, only general guidelines with respect to frequency, intensity, and duration will be presented. So in this particular situation, resistance is the workload or the weight being moved. A repetition maximum, or RM, is the maximum amount of force that can be exerted or maximum weight of resistance lifted in a single effort. The intensity of the workout can be expressed as a percentage of 1 RM. If a person can bench press 200 pounds, 80% of 1 RM would be 160 pounds. A repetition is performance of a designated movement or exercise pattern through the full range of motion, and sets are the number of repetitions performed without a rest. The training program must include time for the muscles to rest and recover from the workout while adapting to a higher physiological level. The same muscle group should not be worked on successive days. Recommended frequency plans are a full body workout every other day. Alternate lower and upper body workouts and working each muscle group 1 or 2 days per week. The intensity of the workout refers to the extent to which the muscles are overloaded. Overload can be accomplished by any combination of the following: increasing the resistance or weight lifted, increasing the number of repetitions per set, and increasing the number of sets per workout. Increasing or decreasing the speed at which the repetition is performed, and decreasing the time of rest between sets. Programs can be designed to develop strength, endurance, or both, depending on the number of repetitions and the amount of resistance selected. The duration of the training program depends on the person's level of fitness, their fitness goals, equipment available, and time available to work out. 1 to 3 sets are often completed of each exercise. The amount of rest between each set varies according to the individual's program. It is recommended to change a strength and endurance program every 8 to 12 weeks to provide variability to the muscles and continue to apply overload. Flexibility can be defined as the maximum range of motion possible at a joint. That is, the extent of movement possible about a joint without undue strain. Although it is one of the most important fitness components, it is often overlooked, and consequently its development is neglected. The extent of movement possible at a joint is influenced by the structure of the joint. For example, the elbow and the knee are hinge joints, allowing movement in one direction. Flexing or bending and extension, straightening, are the only movements possible. In contrast, the shoulder and hip are ball and socket joints. This joint structure allows movement in many directions, usually with a greater range than the hinge joint. Soft tissues such as muscles, tendons, and ligaments greatly influence the range of motion possible at a joint. Flexibility is affected by the length that a muscle can stretch or its elasticity. When muscles are not used, they tend to become shorter and tighter, thus reducing the joint's range of motion. Flexibility is essential to performing everyday tasks and is also a critical component in the performance of many sport activities such as gymnastics, yoga, swimming, karate, and dance place a premium on flexibility. Limited flexibility decreases the efficiency with everyday and sport activities can be performed. Thus, the development of flexibility should be addressed in designing a fitness program. Flexibility is important to good health. It is important for maintaining good posture. Poor posture alignment can cause pain and limit one's ability to move freely. Decreased flexibility can be caused by many factors. People who are active tend to have better flexibility than those who are sedentary. When muscles are not used, they tend to become shorter, tighter, and less elastic. Consequently, flexibility decreases. Age is another factor that influences extent of flexibility. It is important to encourage people to remain active as they grow older so that the effects of aging on fitness will be minimized. Excessive amounts of body fat impede movement and flexibility. Consider the difficulty of severely obese people when they are trying to tie their shoelaces. The fat deposits serve as a wedge between the parts of the body, thereby restricting movement. Flexibility can be improved. Participating in some physical activities can promote flexibility. Swimming, for example, can improve the flexibility of several joints. Also, because the activity is non-weight bearing, swimming in a warm pool is often recommended for people with arthritic conditions. Flexibility can be improved through a stretching program. Because flexibility is specific to each joint, improvement and maintenance of flexibility requires a program that incorporates specific exercises for the major joints of the body. Flexibility exercises can be performed using ballistic, static, contract and relax, or dynamic stretching techniques. Ballistic stretching is a dynamic method which uses the momentum generated from repeated bouncing movements to stretch the muscle. Although it is effective, most experts do not recommend this technique because it may overstretch the muscle and cause soreness or injury. Static stretching is an extremely popular and effective technique that involves gently and slowly moving into the stretch position and holding it for a certain period of time. Movement should take place through the full range of motion until a little tension or tightness is felt in the muscle or muscle group. As the muscle relaxes, the stretch should be extended and held again. Stretching should not be painful, and care must be taken not to force the joint to move too far, which would cause an injury. Stretches should be held from 10 to 30 seconds and a minimum of 5 repetitions performed for each exercise. Flexibility exercises should be performed at least 3 to 5 times a week. If flexibility at a particular joint is extremely poor, a daily stretching program can be recommended. Flexibility exercises also should be performed at the start and end of a workout. Contract and relax technique is one that is performing stretching exercises. It is important that the muscles involved are relaxed. The contract relax technique facilitates the relaxation of muscles. Muscles are arranged in pairs. When one contracts, the other opposing muscle in the pair relaxes, such as when the quadricep muscles contract, the hamstrings relax. When one uses this technique to develop flexibility, the muscle opposite the one to be stretched is contracted for at least 5 seconds. This relaxes the muscle to be stretched. To apply this technique to the development of hamstring flexibility, an individual would contract the quadricep muscles, thus relaxing the hamstrings. This technique allows the stretch to be performed through a greater range of motion. Dynamic stretching, on the other hand, or active stretching, is often used to warm up the muscles before engaging in physical activity and sport performance. Dynamic stretching increases the blood flow and range of motion and warms up the muscles. It should be determined based on the activity being performed as to what dynamic stretches you use. For example, if you're about to run or sprint, you may want to do high knee raises or kickbacks or walking lunges. Dynamic stretching is a type of stretch performed many years ago and is currently increasing in popularity with athletes, even more so than static stretching. Flexibility can be measured because it is joint specific. There is no one test that can be used to provide an overall measure of an individual's flexibility. The goniometer, which is a large protractor with movable arms, provides a measurement of the range of movement in terms of degrees. There also are a number of other tests that have been developed to measure movement at certain joints and require little equipment to perform. For example, the sit and reach test is used to assess the flexibility of the lower back and hamstrings. And that concludes our discussion in Chapter 7. I realize that there's another portion over nutrition in Chapter 7, but I feel like you're going to be getting that information in your nutrition class. I'm actually teaching a nutrition class in summer too, so if you'd like to gain more information about it, you can join us there. I look forward to talking with you soon. We'll be transitioning into Chapter 8, and you guys have a great day.